I'm Dr. Adam Scheiner. In this video, I'll be demonstrating the treatment of lower eyelid festoons by laser skin resurfacing. I learned this technique from my friend and mentor, Dr. Sterling Baker. At this point, the patient had just undergone upper lid blepharoplasty, lower lid blepharoplasty, and ectropion repair bilaterally. What I'm now showing is the looseness of the skin and festoons that we're going to be tightening with the laser shortly.
And actually also right in this area here.
Here, after numbing the surface of the eye, I put in metal contact lenses to protect the eye during the laser procedure. Although this procedure can be performed with either the CO2 or erbium lasers, in my practice I use the Cyton Contour dual pulse erbium laser. This laser has the ability to fire two laser pulses. One pulse causes tissue ablation by delivering effluents above the ablation threshold, and a second pulse which fires energy that can be set at variable levels below the ablation threshold. The second pulse interacts with the tissue to create thermal energy, which translates to collagen and tissue tightening, which the laser company refers to as coagulation. This first application of the laser, we set the laser at 15 joules per centimeter squared. This ablates about 60 microns of tissue. And this first pass, what we try to do is to remove most of the epidermis. And the subsequent passes will put in subablative energy that will cause even more tissue tightening with the application of the laser. I'm using this laser in a freehand fashion with a 4 millimeter spot size and approximately 50% overlap. This creates double the fluence in the treated area. This laser can also be used with a computer-generated pattern to apply the laser energy.
You got all that?
Yeah.
Good.
Great.
Kind of neat already. Looks tighter, doesn't it?
Yeah.
Here I'm using a laser-safe backstop to finally remove the epithelium all the way up to the lower eyelid lashes while protecting the surrounding ocular tissues.
You don't need one more thing. Come out a little farther. Okay, ready?
At this point, I wet a gauze and wipe away the thermally devitalized tissue caused by the first application of the laser. I vigorously rub the skin in this area, and sometimes I can get petechial bleeding as I get into the papillary dermis. I feel that this process creates a smoother framework by which the resurfacing can occur and leads to cleaner ablation and better depth penetration. With this second application of the laser, we keep the ablative fluence at 15 joules per centimeter squared, but with this laser we can then turn on a second laser pulse that fires just a few milliseconds after the first pulse that is below the threshold for ablation. And what happens here is that subablative pulse has an interaction with the chromophore of water in the tissue, which creates thermal injury. And this causes collagen fiber shrinkage and tissue desiccation. We feel this new collagen and epithelium then grows on this new compact framework and replaces, we think, the shrunken collagen. There is art as well as science here, and that the end point is no more collagen shrinkage. And you can see this shrinkage here as I'm showing in this video, and the end point is when we see no more of this shrinkage. With this third application of the laser, we change the settings to 10 joules per centimeter squared with 100 microns of subablative energy deposition known as coagulation. And what happens here is we have an interaction of the laser with the chromophore, which is water in the tissue, which creates thermal injury, which causes collagen fiber shrinkage. And the end point of this procedure is when we see no more tissue tightening as a result of this sub-ablative energy that we're applying, and we're going to be seeing that here shortly.
Okay, cover it.
At this point, we turned off the coagulation and used the laser in a clean 40 microns of pure ablation. And what I'm doing here is outlining the border of the resurfaced skin. And what this does is creates a transition zone or a feathering, which blends the texture and color variations between the treated skin and the untreated skin.
So you're going lighter, right?
Right, and that's a little feathered zone.
Yeah.
Okay? And we're done now.
At this point, the protective metal contact lenses were removed from both eyes.
You got that?
Yeah, I did. I
And this
think I
side.
was zooming at it though.
Okay, this side too.
This is the end of the procedure. At this point, Flexan bandages were applied to the resurfaced skin. This is the patient 1 day post-op with the Flexan bandages in place. This is the patient 3 days post-op after the Flexan bandages had been soaked off by the patient. At this point, the patient began a series of vinegar water soaks interspersed with the application of a lubricating ointment to facilitate the healing of this skin. This is the patient 7 days post-op. This is the patient 10 days post-op. This is the patient 12 days post-op. This is the patient 14 days post-op. This is the patient 16 days post-op. This is the patient 6 weeks post-op. This is the patient 11 weeks post-op. This is the patient before and 11 weeks post-op. Thank you for your attention. If I can be of help to either you or your patients in the future, you can contact me through the information on this page.